So, thanks for inviting me to talk this evening. I could probably talk for hours on this subject, but I thought for condensing it for 20 minutes, the focus would be really on my experience over these last 18 months in lockdown. That a lot of people have obviously, as Jackie mentioned at the very beginning, taken up exercise, become much more aware of their own health. And also, if you think of lockdown 1, where a lot of people were furloughed, had a lot more time on the hands, but equally gyms were closed, swimming pools were closed. So everyone seemed to take to walking and running. And then over the last, I would say, 6 to 12 months, I've really started to see those patients in clinic. I think a lot got started okay, and then problems started to crop up with that. So in terms of the presentation tonight, I thought it would be good to just focus on the how to prepare and reduce running injuries. Okay, so most running injuries come under the umbrella term of overuse running injuries. So with this, what we need to really think about is load, and that has to be the focus. So although I'm a specialist in biomechanics and the sort of assessing for and prescribing of orthoses, there is a lot more that you can look for and treat before you get to that stage. So usually it all comes down to your history taking, and it's about asking lots of questions in terms of how that patient, runner or walker, has got to where they are in clinic with you at their assessment. So quite often overuse injuries involve going either too far or too fast or too often. So in terms of too far, what do I mean? So for example, I would have said now to patients who have come to see me, who give me a typical history of they've increased their running or taken up running since lockdown. So it's established first, well, what was their base level of walking and running fitness before lockdown happened? So were they someone who regularly went out for a walk, but then just decided to start going every day? Or were they someone that regularly walked but decided to up the intensity and start running? Did they follow a program? Or were they beforehand quite busy with work, commuting to the office, sitting at a desk all day, commuting home for the office, and then just crashing on the sofa in the evening? So it's working out what sort of base level they had, and then how did they get to where they are today? So how did they build up their distance? How often did they start going running? How regularly did they have days to rest in between? And quite often we tend to stick with this 10% rule. So for example, if someone before lockdown maybe had time to go for 2 5K runs a week, then over the week they would have been doing 10K. But because of lockdown, suddenly they decide, well, I'm going to go for my 5K run every day. So 5K 7 days a week, suddenly you jump up from 10K in the week to 35K in the week. And that is what we would consider an overuse injury. So, what we should be advising is this 10% rule. So if you've done 10K a week, increase it to 11K the following week, and then 12K the week after. And to some people, it can seem very sort of painfully slow. But actually, if you build the load in gradually, your body is very good at adapting to load and will tolerate that increase in load if it's slow and steady and gradual. So too fast. So this can be either they've increased the mileage too fast, like I've just said, or could it be that they've tried to do some pace work, so speed work, and has that caused their injury? So have they gone from thinking, oh, well, 5K at a steady pace of, maybe 10-minute mile pace, so say 30 minutes to go and do a 5K, But then have they started throwing in much faster runs, or have they started going to a track and doing faster runs there? Have they increased their mileage just too quickly, or have they added in other things too quickly? So have they tried to go and do hill running or trail running, change the surface that they run on just too quickly, and the body has struggled to adapt? All our tissues, whether that's bone, tendon, muscle, will have a tissue tolerance level. And once we go beyond that, that's when we are at risk of injury. So it's about managing that load sensibly and slowly and steadily. And what can be quite useful is most people now have a lot of technology. So whether it's their smartphone or whether it's a very much more specialized piece of running kit such as the watch, a lot of runners will have a Strava account, or they'll be on Garmin Connect or Fitbit or some other form of technology. And it can be really useful to look at that data. So if they took up running, say 12 months ago, you could actually look at that data if they're happy to share it with you, and you can see exactly whether they've increased their mileage too quickly or increased their speed too quickly. And that data can be really useful in trying to establish how they've got injured in the first place. Okay, so then coming back to the load injuries and the overuse injuries again, another cause can be that they've gone too often. So I mentioned at the beginning, did they start off with 2 5K runs a week and then they've gone to every day, or even just training every day where it's load and it's not giving those tissues chance to recover and strengthen in between training sessions. So the body's very good at adapting to the load if it's given chance. So with a lot of my running patients, they come in and they've been running, maybe have 1 rest day a week. And I'll say to them, once we've got on top of this, once we've worked out what the cause is and we've worked out what your injury is, you may not necessarily need orthotics, but let's look at footwear as well. And let's look at a better sort of monitored training plan. So there's lots of training plans you can follow. But even if they don't want to follow a strict plan because life and work and children gets in the way, I always say, try initially and just run run 1 day, have 3 days off. So maybe twice a week. And then if that's fine, then after a few weeks, run 1 day, have 2 days off, and then build that up, and then run alternate days. And I've been running now as an adult for 17 years, and I run on alternate days because I want to be able to run consistently for many years to come, and I don't want to get injured and have to stop. I would be much happier running on alternate days, and then on the days in between, I can mix that up with other things. So it's fine to mix that up with a gym session or a bike session, a swim or something else, but just try not to do the same activity every single day. And I do think that this is more important the newer you are to running. So it's just about learning what your body can tolerate and factoring in those recovery and rest days. So in preparation for this presentation, I had a look on Google at the UK's most Googled running injuries in lockdown. And so this was what it came up with. So searching the term ankle support for running was up by 250%. Sore Achilles after running, that was up by 250%. Searching the term how to help shin splints was up by 600%. And I would say that does actually correlate to the injuries that I've seen in clinic throughout lockdown. Low back pain after running, up by 200%, and a sore knee from running, up by 400%. So that in itself is really interesting that those search terms have jumped up by so much during these conditions of lockdown, where people have had more time on their hands, they have had no gym to go to, no swimming pool to go to. Okay, so in terms of the search term ankle support for running, that could mean numerous things. So that could just mean they're searching for maybe advice on a neoprene support to wear. But there are so many factors that we could be looking at there in terms of ankle support. So we could be looking at footwear. Is the footwear appropriate for running? We could be looking at previous injuries that they've had. So that person who used to play netball or used to play football many years ago may have sprained their ankle ligaments years ago, and they've never really thought much about it. But then now they've taken up this running program, they're suddenly getting problems with their ankle. So that's where in clinic we'd be looking at their strength, maybe their stability, what's their proprioception like, and what's their range of movement like. So anyone that's had previous ankle surgery might have quite a stiff ankle that's got a much reduced range of movement. You might even have those patients that have, in their working environment before lockdown, used to wear high heels quite a lot to go into the office. Suddenly, they're at home, barefooted a lot, just walking around the house, and then they've decided to take up walking and running. So then they've got very tight calves and Achilles tendons, and so then that impacts on their ankle range of movement. And in reality, they probably haven't got the range of movement they need for running. So I would always start off with looking at the basics. So checking a patient's balance in clinic to establish their proprioception. And that is so important with ankles and ankle injuries and preventing them. Okay, so sore Achilles. Now this is typically a loading problem. So here I would be taking a lot of history, asking lots of questions, going back to the first few slides about have they gone too far, too fast, too often. Again, footwear, crucial with this. What shoes were they in before lockdown? What running shoes have they purchased for the purpose, or have they just taken some previous old trainers that they have worn for many years and decided to use them for running because they're new to running, so they don't want to spend lots of money. But typically this can be a loading injury with the Achilles tendon. So it's lots of history, lots of questions, asking about the demographics, height and weight, their background to fitness levels before they took up running. Okay, so shin splints, again, there are lots of factors. This is usually a layman's term, really, that what they're referring to is usually medial tibial stress syndrome. So there's multiple causes of this, but one can be overuse, and then it can become much more complicated and biomechanical. So what I would be looking for here is training errors, their footwear. Are they in the right shoes for them? Is there some muscle weakness? Is there some muscle tightness? And what's their gait pattern like? And that's then before considering any orthotic insoles. So training areas, again, could be, is this surface related? Or is it footwear related? Or could it be that they've done the too far, too fast, too often? So with this, you need to use your history taking skills, a thorough assessment, and then you can develop an appropriate rehab program. So in terms of anyone coming in with shin pain, I would be asking lots of questions at the start of my consultation. Okay, so low back pain. So anyone that's heard me speak before will know that I have an interest in back pain, and that my PhD research was on foot orthoses for low back pain. So we all know, or we should know, that with back pain, you take a biopsychosocial approach, and there are many multiple contributing factors to back pain. But a lot of this can be, are they very sedentary when they're not running? So are they someone that sits at a desk all day and then suddenly they get up and they go for a run? So it's all about their overall general health, posture. Do they get up and move regularly throughout the day? So it may not be that the running is actually the cause of their back pain. And if anything, the more we move, generally back pain is better. It could be that someone is very stressed. It could be that they've got, they're standing all day long. So it can be either or, but what we have to do here is take a full biopsychosocial approach. So if their general health and well-being isn't at its optimum, this can have an impact on back pain. When it comes to actual biomechanics that could be contributing to back pain, then we could be looking at muscle imbalances, we could be looking at leg length discrepancies, and again, proprioception plays a big role in assessing someone as to whether actually the form of running is what's contributing to their back pain. So with this, it's a very much a holistic approach to assessing someone who would come in complaining of back pain after running. And again, searching the term sore knee from running. I mean, this could be all sorts of problems. There's your typical runner's knee, which is usually iliotibial band syndrome, is what we actually refer to as runner's knee because it's very common. And just this one condition can actually be a problem that's relating to foot biomechanics, but equally can actually be more of a hip problem and pelvic control and pelvic instability and weakness that's causing their ITB syndrome. So it's about working out where that knee problem originates from. So they think their running has caused their knee to be bad, but that may not necessarily be the case. It has just highlighted that there's an issue, and it might be that the patient in front of you actually needs to go and see someone for treatment at the hip and pelvis and do more of a strengthening rehabilitative program. But it's your job, if you're a podiatrist, to work that out by taking a really detailed history, what makes the knee pain worse, what's contributed to it. There's lots of research now that shows that running does not cause osteoarthritis of the knee. And everyone will say to you, oh, don't take up running, you'll end up with a bad knee. So we do just have to be mindful of the language that we use when we talk to runners, and working out really, is it the overuse element? Is it that they've not allowed enough recovery in between the run sessions? Is there some weakness or is there some tightness? And establishing why exactly they're getting those knee problems. So all of the things that we need to take into account when we're assessing someone who's new to running or has become quite prone to running injuries are listed here. So we need to look at footwear. We need to look at, how much sleep do they tend to get? There is research and evidence that shows that if we're not getting enough sleep, we are more prone to injury. Equally, if we're not getting enough hydration, if we're not getting enough nutrition, and then if we're not planning in rest days, and we're also not preparing our body so ready for running, so we're just expecting to be able to go out and run 5 to 10K 3 times a week, and that's it. Strength and conditioning work can really help, proprioceptive work can really help, and it's that holistic approach really to running injuries. If once you've done all of the history taking and you've established that they're in the right shoes for them, that they're following the right program, if they rest their injury, rebuild again, and then they get injured. So recurrent injuries and injuries that aren't just because they're a new runner, that's when you would then maybe want to look more into their biomechanics. And that's where things like gait analysis, pressure plates, gait retraining and orthoses might play their role. So it's about knowing really when to refer for these sort of higher level assessments of a patient that's new to running. So in terms of preparing to start running, then you need a base fitness level really. You can't expect to go from being very sedentary, not really ever going out walking on a regular basis, to suddenly being able to run several miles a week. So maybe guiding your patients into a walking program initially, building up the frequency, building up the pace, so they eventually turn to more of like a brisk power walk, getting the footwear right, giving them some strengthening exercises, working on their flexibility, and then building in that running very gradually. Now, to reduce injuries, what we need to do is we need to start slow and short. We need to factor in rest days. We need to build distance gradually, and then we would add speed and hills at a later date. There's also strength and conditioning to consider, stretches, and then replacing footwear as needed. So I've just done a couple of case studies that I thought were really interesting. These are just 2 patients that I have seen throughout lockdown. The first one is a 21-year-old male patient. He was 6'4" and 90 kilos. His job was as an electrician, and his mum and his sister were both very good runners. So he decided to take up running 2 years ago. So this was before lockdown. But because of his job, he was always very busy. So he only ever really did a couple of 5Ks or 10Ks each week. And then he decided to sign up for the London Marathon in April 2020 because he was turning 21 the same day. Now, the marathon was cancelled due to lockdown, but he decided that he was going to do the distance anyway on a treadmill the same day. And then he did that, but then ever since that day, he has never been able to run more than a mile without shin pain. Okay, so with him, there are so many questions you would want to ask. So you'd be asking, obviously he was furloughed in that first lockdown, so then he was trying to go out running most days, but every time he went after a mile, he would get shin pain. So you would be asking, have you actually had a period of rest from doing that marathon on the treadmill? And also, was he familiar with treadmill running, or had he been doing all of his running outdoors and then suddenly switched to treadmill to run a whole marathon on that day? That was only a month after lockdown started. So, you'd be asking lots of questions. And the same with this second patient, completely different in terms of her demographics. She's a 71-year-old female, a retired teacher. She's always walked 2 to 3 times weekly since retiring in 2003. So that was, many years ago, really, and she's walked a lot. But in lockdown, because there was nothing else to do, she'd also previously gone to classes. She'd been a swimmer once a week. She'd done Pilates. So in lockdown, her and her husband increased their walking, and they went 6 miles every single day for a year. And then in March 2021, her foot pain started. It would settle in between walks, but then it would be there sooner and more severely every time they went for a walk again. So she'd got to the point where she came to see me, where she could only walk a mile before the foot pain would start. So again, with her, lots of questions. And then she did end up going for a vitamin D levels to be checked, which showed that she had low vitamin D. And then she went on for a DEXA scan, which did show that she had osteoporosis. So you do just have to be mindful of all those other things that can be impacting on their injury. So these were the books that I thought I would probably recommend if you've got an interest in sports injuries, running injuries, and how to run injury-free. So if you have any questions, thanks for listening, and I'm on all the usual social media if you want to follow me and you have anything else to ask following this.
Thank you, Lindsay, so much. Another really interesting talk, and so full of clinical application and clinical gold there for the clinicians listening who work with this population. We have got quite a few questions, but unfortunately, again, we're so short of time. So if I could just maybe put a quick one to you, and then we'll move on. I might have asked if there's any relationship with ground reaction force as a cause of injury, and I thought it would be something that you could maybe give us a succinct answer on.
Yes.
Yes.
Yes, but then obviously your footwear and all of those things has implications, and obviously the BMI of the patient has implications with ground reaction force, so that probably then opens up a Pandora's box of other questions. Yeah, and I guess in terms of modifying that as well, there would be some clinical tips and tricks to do with styles of running as well as BMI. So retraining gait, looking at footwear, looking at your gait, and one of the big things with shin pain, which I'll just touch on but probably not go into in too much detail, is giving someone advice on just widening the base of gait, because then you don't have so much severe varus angle, which causes the impact and the bowing of the tibia and the shin bone. So just slightly widening that base of gait can make a huge difference.
Thank you so much for just keeping that nice and tight and still bringing some real value in those last few seconds.